Assalamu alaikum wa rahmatullah. For today, we'll start with this session with the dressing, wound dressing. When we are planning to do any procedure, what's the first thing that we have to start with? Even before washing hands.
Assess the injury.
Assessing the injury, how we will assess the injury without coming to the client and opening the previous dressing? So the first thing that we have to see, is there a need for the dressing or not? So you have to verify the need through the client chart. Is it okay? So any procedure, before doing that, you will either verify it from the client chart, or also you will assess the need of the procedure according to your assessment of your patient. So those are the basic steps for any procedure. You have to verify the need for the procedure. You have to then prepare your equipment for the certain procedure. So for the dressing, we have to prepare the dressing set. We have also to prepare dressing set. It is different according to the type of the wound. So to prepare the dressing set, to prepare also the solution which is needed. Either we need a solution like betadine, normal saline, like hydrogen peroxide. It depends upon the wound itself, and it depends upon if there is allergy in the client. So I have to identify if the patient is having allergy before from his history, from the file. Then I have to come to my client. I have to introduce myself. I am Yousef Abukhadra. I am your nurse today. I will do dressing for you. Is it okay? He will say, yes, you can do. Or he might say, this, can I have it later? So it depends upon that. Then you have to verify also the client name by asking his name, and also verifying the client name by checking the ID band from his hand. So we have to verify it by two methods. Then we have to put the curtains for the privacy. So those are basic things for any procedure, before doing any procedure. Then after that, we verify, we prepare our equipment. We have to expose the dressing to find out where the site of the wound. So here, the client is having a wound here in his abdomen. It might be a post-operative surgery. What I have to do before removal of that wound dressing? I have also to put incontinent sheet, because there might be a secretion is coming out, or also to protect from the fluid that I am using for the cleaning of the wound. When I expose, also I have to expose just the side that I want to work on. This is to avoid embarrassment of the client also, and embarrassment for yourself. Then I have to wear a disposable gloves in order to take the previous dressing out. Before taking the dressing, also I will check the dressing. Is it solid dressing? Is there any secretion coming out? Is there any also drain beside that dressing? So all of those things I have to assess them before starting doing the dressing itself. Then I will come to get out the previous dressing. I will start with the plaster. if the plaster is stuck there, I can loosen it with a normal saline. So I can use normal saline to make it wet. By that, it will come with me easier. So I remove it. I have to put it inside a yellow bag. So those contaminated equipment or things that disposable thing, I have to throw it in a yellow bag to be incinerated there. Then I have to check the wound itself. What type of wound is it? Is there any secretion? If secretion is there, what type of secretion? What's the color of it? And also, if there is a smell coming from that secretion, is there any abnormal thing around this wound? If there is a drainage, what's the type of the secretion which is coming from the drain? So all of those things I have to assess it. I will assess if there is no secretion. I will assess if there is redness, if there is any sign of inflammation, redness, hotness, tenderness, pain. So all of those signs I have to check it before doing the dressing. And this also, it has to be reported later. If any obvious changes that is not expected, I might report it immediately to the physician. So those are the things that we have to observe during or before putting those. Then after that, I have to wash my hand. I have to get rid of those gloves again, and I have to wash my hand then I wash my hand. After washing my hand, I have to prepare the dressing set and the solution for cleansing. When I use the dressing set, I have to look if there is a date for that, so it should not be expired. I have to look also for the sign of sterilization. It has to be, usually this box, it has to become brown after sterilization. So if it is not brown, it means that it is not sterile. Then I will open the dressing without dressing set, without touching it with a bare hand. So this is, I can use what we call it the non-touch technique for opening of it. So I just open it from outside. So I will maintain the sterility. I will not touch anything by hands. I can have some assistance from others. It is better always to do the dressing with a two person. One of them will help you with a non-sterile equipment. Because when you want to pour the solution, the bottle of the solution from outside, it is non-sterile. So if I am wearing a sterile gloves, then I touch that solution or antiseptic solution bottles, it means that my hand is becoming unsterile. So what's the benefit of wearing the sterile gloves in this case? We can use sometimes non-touch technique, even without, for a simple wound, without wearing the gloves. But in this case, we have to arrange our equipment. We have to touch the forceps from just the end, which is away from the cotton side that we are using. We will use it during that. So, as we said, the solution depends upon the wound itself. And we have to avoid the solution that the patient is having allergy to it, if the patient is having allergy. When I pour the solution also, I have to pour it also before wearing the gloves in this case, if I am alone. I have to put it while being away from the dressing set and not touching the sterile field. Then I have to wear the sterile gloves. For any sterile object, usually there is a side that I can peel it from it. So from here, yes, I will peel it. Without touching the gloves from inside, I will insert my hand. I will touch only the side that will come untouched in my hand. Then the second here, I will touch it like this, and then I will insert my hand inside. After that, I can deal with the wound. I have to clean it. I can use, depend upon the wound itself, I can use normal saline, and I can use betadine, hydrogen peroxide. It depends upon the wound itself. Here, if it is a clean wound, I can use just normal saline, betadine, and then clean it with normal saline. I will immerse the cotton swab or the gauze swab in the solution, then with a rolling motion, starting from the center, and roll it like this.
We can see you, Mr.
I know that. You will not be able to see well. Because of that, I am doing. So then I have to put the used one in the jelly pots. See, I will dip it inside the solution. I will squeeze it. I can use also the other scissor or the other tweezer for squeezing the extra fluid. Then a rolling motion. Just I will pass over the side of the wound only one time. So it is just a rolling motion like this. I will continue with that, starting from the center of the wound toward the edges. So starting from the center of the wound toward the edges until I finish. Then I have to clean with saline after that to avoid the irritation of the betadine. If any fluid also is coming out to the skin, I have to clean it properly, which is away from the skin. Then I have to dry it. After drying, I have to use pieces of gauzes to cover the wound properly. I will choose the size according to the size of the wound. Usually it is difficult to apply plaster while I am having gloved hand. So if I have someone to help me, in this case, he can apply the plaster, or I have to get rid of the gloves and then apply the plaster. The plaster also, there are different types of plaster. Be sure that the patient or the client is not sensitive to the type of the plaster that you are using. There is zinc oxide, there is a paper type, there are many types of plaster. So we cut the piece of plaster to suit the size of the dressing, and we will apply it. After that, I have to remove the used equipment, cover the client, put him in comfortable position, and return the equipment to place, dispose any disposable equipment, and go for recording and report. What you have to report and what you have to report in this case, what we are going to record. Just raise your voice.
I do one for the situation, I do for the
I will write that I did a dressing for the client. It has any recording. It has to include the time, the date and the time. Now, by the computer, when you open, click for recording the time and date, it will appear by itself. And you will be opening by your ID, so also it will be recorded in your name. But in the paper file, we have to write the date and time. Then we have to write the dressing is done for the client. We have to describe the wound, description of the wound. It includes what kind of wound is it? Is it a surgical wound? Is it a lacerated wound? Also, if it is regular or irregular edges, if it is sutured or not sutured wound, if there is a secretion from that wound, if secretion is there, what type of secretion? Is it a serous fluid? Is it blood? Is it pus? So the type of the secretion which is coming out from that wound. If there is no secretion, also we have to assess if there is inflammation or not. Redness, hotness, pain, tenderness on that wound. So all of those things, it has to be included in your recording. And also, it has to be reported if we observe any abnormalities. We have to report it to the head nurse, to the responsible nurse, or to the physician. And as we said, sometimes some of the things, like if the wound, it is a surgical wound and it was a clean one, and when we open it, we find that it is infected, we have to inform the surgeon immediately to see that wound before covering it. Okay? So, recording and reporting, it has to be done. Then I have to return my equipment to its place and dispose the thing. Return the client to a comfortable position, and we can come later to see what's if he is having anything related to that or for guests. Is it okay?